You could possibly be suffering from one of the most irritating diseases, and you probably don't even know it yet. Night symptoms of irritable bowel disease are the most uncomfortable and can be quite tiring when experienced. However, choosing the right strategies for managing such a condition is entirely possible. Not all these may occur during the daylight, but when they do, that's usually at nighttime, and it's your body screaming the loudest at you, something's wrong. Number 5. Nighttime diarrhea. Let's start with one of the more common yet distressing symptoms: frequent diarrhea at night. One thing is going through this during the day, but if it wakes you up several times at night running for the bathroom, then it becomes nothing to be taken lightly. This is particularly concerning as it means the issue is not just about diet or stress. Inflammatory signals show that there must be a swelling in the intestine, one of the chief characteristics of IBD, by which your intestine swells and fails to perform absorptive functions when this starts to inflame or hurt. This way, it produces poor digestion and hastes along with urgency, taking your bathroom trips swiftly as fast as possible. This symptom will interfere with your sleep, and you will wake up tired, irritated, and less capable of handling your daily responsibilities. More importantly, chronic diarrhea can lead to dehydration and malnutrition, complicating your health further. If this happens to you regularly, then it's time to see a doctor. Number 4. Abdominal pain that wakes you up. Do you wake up to shock with sharp or cramping pain in your abdomen? That is one of the main symptoms of IBD. It may be stabbing, twisting, or even a dull ache that will not let you rest. This is because inflammation in your digestive system causes spasms or irritation, especially when your body rests. You tend to forget about it if you are busy with work or doing something during the day. It's only at night that you notice it because your body is quiet and at rest. It's not only discomfort, it can indicate a more serious underlying condition if the abdominal pain persists. In the long term, unattended inflammation may result in intestinal damage or complications, such as strictures, which are narrowings of the bowel that make food passage more difficult. If night pain is becoming a chronic problem for you, do not hesitate to seek medical advice. Early intervention may help prevent the condition from worsening. Number 3. Waking up sweating. Now, let's talk about those dreaded night sweats. It is not just a bad dream or an overheated room. If you wake up drenched in sweat, it may be the time when your body is warning you of an inflammatory condition, such as IBD. It is from the excess work done by your body in combating the inflammation caused that night sweats occur. To individuals with IBD, their immune systems are hyperactivated and continuously attack the intestinal lining while there is no real invasion. Such a war occurring inside causes a rise in body temperature that may also lead to excess night sweating. While sweating at night can be infrequent due to a range of factors, persistent nocturnal sweats, when accompanied by other symptoms such as diarrhea or stomach pain, should not be dismissed. This symptom could also indicate infections or IBD-related complications, and thus, one should seek attention. Number 2. Lack of rest. Despite sleep. Have you ever slept for 8 hours and woke up feeling completely drained? Fatigue is a lesser-known but incredibly common symptom of IBD, and nighttime plays a big role in it. Here's the thing. It may be technically sleep, but the presence of diarrhea, pain, or sweating can interrupt your sleep cycles. Absent deep, restorative sleep, your body doesn't recover, repair, and refill itself. Moreover, IBD results in chronic inflammation, and patients with IBD often start draining energy levels from the start. Their bodies are constantly working to fight off the invading inflammation, leaving them tired of whatever rest is granted. Nutritional deficiency also results from fatigue, often because of impaired absorption in the gut. That is, your intestines don't operate to the full extent. And then essential nutrients, for instance, iron, as well as vitamin B12, can't get absorbed properly, resulting in anemia, along with several conditions that leave one feeling weaker. If you experience mysterious fatigue, it is high time to look deeper into its cause. Number 1. Rectal bleeding or bloody stools at night. Lastly, the most serious symptom for listing is rectal bleeding or blood stools. Though it is an occasional occurrence, its observation during a nocturnal bathroom trip raises much cause for alarm. Blood in your stool is an indication of intestinal inflammation, ulcers, or fissures, all linked to IBD. The blood could be quite vivid red, indicating problems closer to the rectum, or darker, indicating problems more proximal in the gut. This symptom is not only uncomfortable, but dangerous as well. Chronic blood loss can lead to anemia, leaving you tired, pale, and weak. Moreover, unattended bleeding may lead to many complications in your digestive system. Bleeding in the stool means you should panic, but don't ignore it. Count how frequently it occurs and report to the doctor as soon as possible. What causes these nighttime symptoms? So, why do these symptoms flare up at night? This answer lies in the way your body is also slower at night, and this slows the activity of the digestive system, creating room for inflammation and irritation. This can sometimes exacerbate the situation, such as sleeping with acid reflux or with abdominal pain. Stress and diet can also factor in. Eating heavy meals or trigger foods before bed can irritate the digestive tract and worsen symptoms. IBD isn't just a daytime problem. It's a 24/7 condition that requires careful management. Managing nighttime symptoms. If you're experiencing any of these symptoms, don't lose hope. While IBD can be challenging, there are ways to manage it and improve your quality of life. Here are some tips. Monitor your diet. Keep a food diary to track which foods are causing your intolerance, and avoid those triggers, especially at night. Common culprits are spicy foods, dairy, and caffeine. Avoid eating heavy or fatty meals late in the evening. Your digestive system works slower at night, so consuming difficult-to-digest foods close to bedtime increases the likelihood of symptoms. Incorporate foods that reduce inflammation, such as salmon, spinach, turmeric, and blueberries. Routine. Eating at the same time every day trains your digestive system to work more predictably. This can help prevent unexpected flare-ups and regulate bowel movements. Do not eat or drink a lot before bedtime. Eat small, balanced meals throughout the day instead of large portions. This will not overburden your digestive system, especially during the evening. Elevate your head when sleeping. This can help to ease symptoms like acid reflux and stomach pain. Use an adjustable bed, wedge pillow, or even a stack of regular pillows to elevate the upper part of your body. Ideally, your head should be raised about 6 to 8 inches above your feet. It helps reduce discomfort and results in a better night's sleep. Studies have proven that showing on the left side helps aid further digestion because it causes the natural flow of waste down your digestive tract. Hydration. Drink plenty of water throughout the day to prevent dehydration from diarrhea or night sweats. For those who get diarrhea regularly, electrolyte replenishment is necessary. Add natural electrolyte sources to your diet, such as coconut water, bananas, and leafy greens. Opt for electrolyte drinks low in sugar. Don't drink beverages that cause the body to lose moisture and aggravate inflammation, such as caffeine, alcohol, and fizzy sodas. Seek medical attention. Do not delay in getting a medical consultation to get a proper diagnosis and treatment strategy. Medications such as anti-inflammatories or biologics are miracles for IBD. Such symptoms as nighttime diarrhea, rectal bleeding, and significant pain should never be dismissed, as they can represent more critical complications such as strictures or fistulas, which call for an immediate response. For people with IBD, regular monitoring is essential. Mainly, these conditions would require regular blood tests, colonoscopies, and imaging scans, hence trackable disease progression and adjusted treatment. Why you shouldn't ignore these signs. These signs ignored at night can lead to severe complications. If left untreated, IBD causes intestinal damage and strictures, or even colorectal cancer. In addition, it affects your psychological health with stress, anxiety, and depression. Paying attention to your body's signs and getting early help puts you in control of your health and prevents long-term complications. The night is perhaps supposed to be the time for rest and recovery. For others who have IBD, however, it becomes a nightly struggle. Symptoms range from diarrhea and pain to fatigue and bleeding. Warning signs that your body needs attention. If you or anyone close to you is suffering from such symptoms, then act. Discuss it with a healthcare provider, and you'll make lifestyle changes, focusing on your health. Your health is well worth it, and by the right approach, you can control IBD well. With professional help, you will better understand your condition and access advanced therapies that dramatically improve your quality of life. No matter how much effort one puts into managing IBD nighttime symptoms, it's no easy feat. With the right strategies in place, you will have full control over your health and rest peacefully. Each step in diet monitoring to seeking professional help plays a crucial role in managing this condition. Take action today, and let's ensure that IBD doesn't rule the nights. Thanks for watching. If you like, share, and subscribe for more health tips and insights, then this information is helpful. Keep informed, stay healthy, and take care.